thyroid issues, the real cause. What's going on, Secoya Nation? Today we are talking about some wisdom, because we're in an age of information, but we're not in an age of wisdom. So let's talk about your thyroid for a second here. If you understand that a lot of functional medicine practitioners, and functional medicine basically means you're looking at a human being through a systemic approach. You're saying what are their systems and how they're intertwined. A lot of our colleagues in functional medicine like to say, well, your TSH is off and your T4 is off, and you look at your reverse T3, and they talk about all the lab ranges that are not generally talked about by your general practitioners, your medical doctors who are not trained in a functional mentality, if you will. What we want to take a step back and say is, if your thyroid is off and you haven't been kicked in the throat by a mule or hit by a hockey puck, like I'd like to joke about, if there hasn't been an injury to your thyroid, then there's nothing wrong with your thyroid, because your thyroid is doing what it's told by the brain. So if you look at the hypothalamus to the pituitary, the HPA, and the thyroid axis, then you say, okay, I got to go up to the brain and figure out what's going on, because everybody wants to give you a pill for a symptom and treat you like from the throat down, or say the throat is the problem, like the throat being the thyroid is right here if you're not familiar with it. So let's talk about, how are you feeling powerless? How are you feeling voiceless? How are you feeling like, I got to get it done so fast, but I'm never going to get it done, right? These are the ideas related to thyroid. And so whether you have Hashimoto's thyroiditis, which is like 80 to 90% of all hypothyroid conditions in the U.S., or you're hyperparathyroid, or you're hyperthyroid, whichever one it is. Maybe you have thyroid cancer. Maybe you had a goiter. Maybe you had it cut out. It just doesn't, it just depends on your situation. But take a step back and say, where don't I have a voice? Where is my voice going? Where do I feel like I can't impose myself on my world? Where am I feeling like someone else is driving the ship and I have no say in the matter? Okay? This is the real cause of thyroid issues. You can look at the labs all day long. You can take supplements all day long. You can have surgeries and things like that all day long. Radiation if you want. It's not going to solve the problem. Because in the absence of a trauma, hear that loud and clear, in the absence of a trauma, the issue with the thyroid is coming from the brain. And it's the neuroemotional trauma. So start learning about neuroemotional traumas, neuroemotional stressors, neuroemotional triggers, things like that related to voiceless, feeling powerless, not being able to assert yourself. You have not been able to speak into reality what your true desires are, or you've tried to speak up but someone has shut you down. Someone's marked your territory and you can't mark it back. Okay? So this is what we specialize in, because we can help the functional medicine, that's easy, but if you stop taking the pills, then your symptoms come back. Okay? If you want to treat an autoimmune disease, treat the immune system, not Thyroid or levothyroxine and things like that. Go to the brain. I hate the meme like they say it's the brain, stupid, but you're not stupid. You're just suffering. So get connected with your brain, understand what the stressors are, get with somebody who knows how to help you heal that, and then you're set for life, because you'll never be the same person again. You'll use your voice, you'll stand in your power, you'll assert yourself, you'll take over command of your world, and that's when you're truly living. All right, guys? So that's your daily wisdom for today. We'll be sprinkling these daily wisdoms in amongst the daily insights, because people want information, but they also want wisdom, and that's what we're here to deliver for you. All right, guys? Have a great night. Bye-bye.